It's no longer a foreign threat. The virus is here at this Lanarkshire hospital, where two people, both in isolation, have now been confirmed as swine flu patients.
That moment came back on the 27th of April, when a couple in Scotland became the first people in the UK to contract swine flu after getting back from their honeymoon in Mexico. Now, a couple of months later, it's been confirmed that there are just over 3,500 cases of swine flu in the UK, 3,597 to be exact. The worst hit areas are the West Midlands, Scotland and London, where swine flu is being transmitted more rapidly. But health officials say they're not worried about the increase and the government's got things well in hand.
I'm pleased to be able to tell you today that we've now signed contracts with GSK and Baxter to secure enough vaccine for the whole population. This takes us another step closer to what is the single most effective way of limiting the impact of this pandemic.
Yesterday, another case was also confirmed in Northern Ireland, making 19 in the province. And Chief Medical Officer Sir Liam Donaldson warns we could see more cases in the autumn.
It could be that we're in the situation of the previous pandemics that we know about in the 20th century, where in this country during the summer months we saw a steady climb in cases rather than an explosive outbreak, and that we would see the explosive outbreak in the autumn and winter. That's still the scenario that we believe we're in.
Hospitals in the West Midlands, which has been worst affected by the virus, have brought in special assessment areas to cope with the influx. And today, 10 students at the University of Exeter have tested positive for swine flu. The Health Protection Agency said they're mildly affected by the virus and are getting the appropriate treatment. So far, 3 other people in Devon have also got the disease, 2 adults in Plymouth and a 12-year-old girl in Torbay.